We're going to talk now with someone who is directly involved in these negotiations, and that is the Republican congressman from North Carolina, Greg Murphy. He, of course, a member of the House Ways and Means Committee, which is one of the key committees dealing with this one big, beautiful bill today during their markup session. Congressman, and I should say Dr. Murphy, it is a pleasure to have you, and thank you so much for joining us. Just give me an overall sense. How do you feel like your markup is going right now in the Ways and Means Committee?
Well, we've just kind of started the what's expected to be probably 24-hour markup. Folks are getting in their initial arguments. A lot of, obviously, Democrats don't like some portions of the bill. Republicans, some are pushing back. These are just the initial, it's the initial fray before really the text of the bill really gets we dive into it, rather.
I want to put up something that you posted last week where you say, as the House Ways and Means Committee works through the budget reconciliation, I'm committed to fighting for meaningful spending cuts that reduce the growth of our fiscal deficits and ensure that our nation remains financially stable. You know, obviously, there are a lot of components to this bill right now. As it stands, do you feel that the cuts are meaningful enough, or do you think that there needs to be more subtracted to make sure that the deficits don't grow?
Yeah, you know, Ryan, that's an excellent question, because when it comes to the bottom line, the most important thing I'm concerned about right now is the growth of our deficit. You know, bond markets across the world are saying, well, gosh, can the United States pay back its loan? Are they going to default on their debt? And if so, 1929 looks like a spring holiday. We cannot allow that to happen. We also know that if you don't continue the TCJA parts that were started in 2017, Americans face $4.7 trillion tax increase. It's a huge tax burden upon America. So threading the needle is going to be critical. We want pro-growth policies that allow companies to invest. And guess what? They employ more people, giving them meaningful work. But at the same time, we don't want to, grow on our deficit. I think this is a good bill. Is it a perfect bill? No, but only I would write a perfect bill, as also many politicians say. But I think it's definitely a step in the right direction.
So let's talk a little bit about one of the big divides, and you talk about the impact on the deficit. Obviously, there's a big conversation about the impact that cuts have on a deficit, but there's also a revenue component, right? And one of the areas that you and your colleagues are having a very strong debate over is the future of the SALT tax cap, which, of course, is the state and local tax deduction. You're from North Carolina. This isn't thought of as being a high tax, locally taxed state, but your colleagues from New York and California, in many respects, the majority makers for the current House Republican caucus, have said that they want that cap to be bigger. You are a tax writer, sir. Where is the needle? Where can you thread that needle to find something that your colleagues will be palatable with?
And that's a complex issue, because we look at states like California and New York where they tax the living hell out of their citizens. That's why there's such an outgrowth of people from those states to come down to places like North Carolina. How do you find that dotted line? How do you find that perfect balance? Some people want no SALT whatsoever. I'm not one of those. I think $30,000 was a pretty good step in the right direction. Some people want much, much more, which is just unreasonable. We have to find a sweet spot, because, as you've pointed out, there are people on the far right in this conference that don't want anything. But we have to be really smart and complex, or rather having complex attitudes towards this, to be able to find that right spot. That's Speaker Johnson's job. I wouldn't want his job at all in the world, trying to bring the two far groups together. But hopefully he'll be able to accomplish that today.
So is $30,000 enough for you? Because, you know, some of your colleagues, Nick LaLota, for instance, has said he's a hell no at a $30,000 cap. Are you willing to go higher?
Well, I think that we have to look and see what he's really offering. Is it $130,000? Hell no, we can't do that. That's a $1 trillion tax on the taxpayers. Again, it's awarding a state legislature in New York or California that is absolutely unreasonable with their tax structure. We want to help Americans so they're not overly taxed, but at the same time, we don't want to add further things to our deficit. You can't be hell-nosed in this thing, and if you are, it's really not helping the process at all. All it's doing is staking a place in the ground that really doesn't need to happen. We need to have good, honest discussions where there is give and take on both sides, so that we come to something that's meaningful and something that can work for the American people.
All right, well, let's talk about the cuts side of this debate now. And I know you're not on Energy and Commerce, but you are somebody who has a unique perspective on this, given your background as a healthcare provider. And I want to play something for you that Senator Josh Hawley told me today about his concerns around proposed Medicaid cuts. Take a listen.
I've got some concerns. I mean, listen, I think the fact that they're not doing adjustments to the funding formula for the states is good. The fact they're not doing the per capita thing anymore, that's good. But they are talking about changes to the hospital provider formula that will affect potentially a lot of rural hospitals in my state. They're talking about additional patient co-pays, burden sharing, cost sharing, whatever. I want to understand how that'll work in my state exactly.
Is he right to have those concerns, sir? Especially, I mean, I know you represent a number of rural hospitals in your district in North Carolina. Do you think these Medicaid cuts could impact those hospitals?
Well, Ryan, I have to say I'm almost in some ways more uniquely qualified to deal with this or talk about this than anybody in the whole conference. I still practice. I've taken care of Medicaid patients for 35 years. I've worked in a hospital that we have a terrible payer mix where 74% are Medicare, Medicaid, and no insurance. This is challenging. We look at what's gone on with the Medicaid system and some of the taxes that states have really abused in some of this regards to gain money from the system. I look at the fraud, waste, and abuse, and I see it every time I see patients, people who are on Medicaid who honestly shouldn't. They should be working and they should be having health insurance with some other company. There is places that we can pare down this. I think really slowing the growth of Medicaid is going to be critical to this entire endeavor. I look at the state of North Carolina, Ryan, and this is just a tragic statistic, that 52% of the babies that are born in the state are born to mothers on Medicaid. How does that happen? How does that happen? It's tragic. So we have to get hold of this system. And, you know, I think if rural hospitals, it's rare that rural hospitals now are not associated with systems. There are some that do that. There are a few that survive, and God bless them. But it's just a critical thing that we've had accountability for once in Washington, D.C. We cannot kill this nation with our sovereign debt crisis if we don't cut back on some things.
I don't think anyone would disagree with you that there are numerous examples of fraud, waste, and abuse in the healthcare system. Sure. But I've yet to find somebody that can identify $800 billion worth of fraud, waste, and abuse in the Medicaid system. Well, do you really think you can get to that number just by trying to rein in and reform the process? Or will it mean that individuals that right now are receiving that care are going to lose it?
Well, Ryan, it's not going to be that much. We're talking with Chairman Guthrie the other evening. It's not going to be nearly that much coming out of Medicaid. There's going to be a lot of savings that are coming from other programs that are in that. So that $880 billion, to my understanding, is not fully coming from Medicaid. You know, this is just, it's the balance that we've had. We've grown government. We've grown government dependency. We've grown the Medicaid. Good Lord, during the Biden administration, they would not allow states to audit their own Medicaid rolls. So at one point, we had 1 in 4 Americans on Medicaid. That's not a viable path forward for any type of financially sound system in the country. So we're looking at these things critically. You know, is there pain? Absolutely. Is the whole tariff issue critical for our nature's manufacturing future? Absolutely. So we're trying to do things thoughtfully to try to really save the system and get Medicaid dollars to those who truly deserve it, who are truly eligible, and get individuals off the system who should not be. They should be working.
Yeah. Congressman, very thoughtful conversation. But before I go, do you think you can have it done before Memorial Day? Is it going to pass the House before Memorial Day? Is that realistic?
Ryan, hope springs eternal. Let's just put it that way.
All right. That's good. Very diplomatic, sir. Great conversation. I appreciate you being here. Thanks so much.
All right. Have a great day.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.